For demonstration purposes, we have the PRAFO APU superstructure without the liner system to illustrate the adjustability features more clearly. To custom fit the PRAFO APU or any of Anatomical Concepts' PRAFO family of orthoses, we recommend taking a series of measurements to ensure the proper fitting of the device. These measurements should be determined with the patient standing, if possible, or in the supine position. First, measure the distance from the posterior aspect of the heel to the most distal point of the large toe for the adjustable toe extension segment. Proceed to take a measurement from the base of the heel to the apex of the calf muscle for the adjustable calf extension segment. You may also place a small mark on the patient's calf to ensure the height of the calf segment is properly placed. In some cases, your patient may present with a tight heel cord, which will require an additional measurement of the foot-ankle complex. Again, with the patient either standing or supine, take a goniometric measurement of the patient's foot-ankle end-range position in the sagittal plane to determine the setting of the adjustable posterior single upright. You are now ready to apply all the measurements recorded toward the fully adjustable features of the device to ensure a proper custom fitting orthosis. Begin adjusting the foot length by loosening the two distal screws found on the plantar aspect of the walking base. Simply slide the toe extension distally or proximally and cross-reference your final measurements accordingly. Be sure to retighten the screws securely after the adjustment is made. To adjust for the calf height, begin by loosening and removing the two attachment screws and detach the calf segment. Approximate the correct height position according to your measurement and reattach securely. To adjust the posterior single upright, slide the protective cover away from the joint to expose the two screws. Loosen both screws and set the foot-ankle segment based on the measurement recorded earlier to accommodate the patient's end range. Retighten the screws securely after the adjustment is made. With your patient either sitting or supine, proceed to fit the orthosis with the liner fully opened. Have your patient flex their knee to approximately 60 degrees and dorsiflex their foot to a neutral position if possible. Based on the patient's condition, you may have to assist by gently grasping the patient's toes and applying the orthosis against the foot and calf. Start securing the liner over the patient's lower extremity by folding the flap on the buccal side first and then overlapping the adjacent flap. Secure the middle strap first to anchor the orthosis in position. Then proceed to secure all the remaining straps while carefully evaluating positioning of the patient's heel within the orthosis, assuring that the heel is not in contact with the device and is fully suspended away from the posterior single upright. If contact does occur, we recommend refitting the PRAFO or adding additional padding under the calf liner to offset this contact. To allow for a comfortable and stable fit, be sure to trim away any excess material on the felt calf pad before securing the calf strap against the patient's leg. Be sure to not overly tighten the calf strap to ensure circulation is not compromised. Proceed to then trim the calf strap and all remaining straps to finalize the custom fitting of the orthosis. Once completed, have the patient fully extend their leg and evaluate positioning and any rotational anomalies. If unwanted internal or external rotation exists, pivot the posterior rotation bar accordingly to offset this rotation. Once you are finished fitting the orthosis, carefully inspect the position of the patient's heel to ensure there is no contact with the superstructure. Also for the walking base, if necessary, the polypropylene toe extension can be trimmed just beyond the distal end of the toes in a manner normally employed by those trained in the art of thermoplastic orthotics. You have now successfully completed the custom fitting of Anatomical Concept Incorporated's PRAFO APU orthosis.